Okay, so good luck. Hi, Miss Jones. My name is Brittany. I'm going to be your nurse today. I have closed the door to provide you with some privacy. Can you please tell me your first and last name? Okay, and what's your date of birth? Great, so I verified that you are the correct patient. I'm going to perform hand hygiene. Today I'm just going to be inserting a Foley catheter. So I am going to have you lay on your back with your knees bent and your legs spread apart. Then I'm going to I'm going to clean off your perineum first. It's going to be a little bit cold. I'm going to take this cleansing wipe. First, I'm going to clean the labia furthest away from me with one swipe down. Then I'm going to change the position of the cloth, and I'm going to do the one closest to me. Then I'm going to change the spot on the cloth again, and I'm going to do right down the middle. Okay, I'm going to dispose of that. Now I am going to remove my gloves and perform hand hygiene. So I'm going to now open the sterile Foley container. It's between your legs. I'm just going to open one side. Next, and open the side closest to the patient. Now I'm going to take the sterile gloves. I'm going to open them in a flat position. Now I'm going to open it up, making sure not to touch anything. So now I'm going to take my non-dominant hand and pinch the cuff portion. Okay, now I'm going to go on the inside. Okay, I'm going to dispose of that properly. Now I'm going to take the drape and I'm just going to grab the corners. I'm going to shake it open with the shiny side down. I'm just going to place it under your bum, so I'm going to need you to lift your hips for me. There you go. And I'm maintaining sterility by not touching anything outside of the sterile field. Now I'm going to take the fenestrated drape, also with the shiny side down. I'm just going to place it over the perineum. Here we go. Okay. Now I'm just going to prepare everything. So I'm going to open the alcohol swabs and the lubricant. Okay. Then I'm going to take this piece off. You should probably be able to see. Can't really see it there, can you? Okay. And then I'm going to take this. Okay. I'm going to take the top portion out. And I'm just going to grab 2 to 3 inches from the top of this and put it in the lubricant. Okay, and then I'm going to take this and I'm going to attach it to the balloon pump. Sorry. Okay. Now that that is set up, okay, I'm going to clean off your perineum. It's going to be a bit cold, so first I'm going to wipe in one swipe the labia furthest from me, and I've identified the urinary meatus, so I'm just going to do one swipe down, one swipe on the side closest to me, and one swipe down the middle. Okay. Now I'm not going to move my hand because that would ruin the sterility. I'm going to take this 2 to 3 inches down. I'm going to insert the catheter now. Please take some slow, deep breaths. Do it quickly. Okay. Now that it's 2 to 3 inches in, I have noted some urine come out, so I'm going to do about an inch or two more, and I'm going to stabilize it with my non-dominant hand. I'm going to inflate the balloon. Okay. I'm going to remove it, place it in there. I'm going to gently pull on the catheter to ensure it's in place, and it is. So now I'm going to let go, and I'm going to clean up my area. So I'm going to gather all the supplies. And I'm going to put them all in the appropriate receptacle. I'm going to take the fenestrated drape to wipe off the excess iodine. There you go. Making sure not to tug on that. And I'm going to secure this onto your thigh with the device that would have been provided. And it's secured. Now I'm going to grab, all of the drapes. Take off those. And I would put it in a appropriate receptacle, perform hand hygiene. And I would make sure that the bag was hooked to the appropriate site below the patient. I obviously don't have that, but it's fastened correctly. I would make sure that the patient was comfortable, and again, I would have performed hand hygiene, discarded of all the supplies appropriately. I'm going to go document, and I would leave the patient with the call light in reach.